I would like to thank you very much for this opportunity of being here addressing the Winter Symposium of the Christian Medical College in Vellore and the South Asian Regional Symposium on Evidence-Informed Healthcare, and particularly to Dr. Pratap Tarian, who made the formal invitation and has helped us in the preparation of this session. And this is really a theme that is dear to our heart at WHO, of how to use new methodologies and practice to improve evidence to policy in low and middle income countries. In terms of the discussion topics, we will address first the evidence-informed policy and identify country demand and evidence-informed policy as one of WHO core functions. We will discuss what is the evidence-informed policy network, and also how does Evipnet work. And finally, how can Evipnet methodologies, mechanisms, and experience help initiatives or similar initiatives in South Asia. First, I would like to start by quoting Keynes, who, as you all know, was both a researcher and a policymaker. And he mentioned that there is nothing a politician likes so little as to be well informed. It makes decision-making so much more complex and difficult. However, this brings us to a question of why research output is so relevant to policymaking. What is research output for? We know that policymakers have demanded WHO to promote user-friendly manners, to use research results to inform policy. For WHO, research and its use must be totally integrated, because the ultimate goal is for WHO, research outputs must improve the health situation of populations. In the 58th World Health Assembly in 2005, WHO member states urged the organization to establish or strengthen mechanisms to transfer knowledge in support of evidence-based public health and healthcare delivery systems and evidence-based health-related policies. So this identified clearly a demand by ministers of health and other senior public health authorities in the countries that WHO should make all efforts to really promote evidence-informed policy. So, contrary to what Keynes had mentioned, we found several champions of the use of research results into policy making. Among them, the Honorable Minister of Health of China, that in a journal article mentioned that it's our responsibility to bridge gaps between decision-making and scientific research. Also, in the Bamako Global Ministerial Forum on Research for Health that took place in Mali in the end of 2008, the Honorable Minister of Mali stated that that Mali would be promoting the cooperation between researchers and policymakers to translate evidence into action, and that this should be a global task. And there is renewed awareness that research is not a luxury that our countries of the majority cannot afford. On the contrary, as Dr. Hassami Shinda, who is now the head of science and technology in Tanzania, mentioned, if you're poor, actually you need more evidence before you invest rather than if you're rich. So how to better use research results? What mechanisms, tools, methodologies, and processes should we use? Evipnet, I would like to present as one successful example of how this can be done. There are many others. but we will focus today on this experience of Evipnet, which is a WHO program that we'll describe in more details afterwards. Knowledge translation is a relatively new field, especially knowledge translation into policy. Knowledge translation to policy is a relatively new field. We at WHO define knowledge translation, which is also called knowledge transfer or knowledge transformation, as a research process to promote the use of research evidence into policy making, taking into account multiple factors, such as political environment, resources, regulations, legislation, tacit knowledge, best practices. Thus, knowledge translation is not a matter of only communicating research results. It's a whole innovative process of producing and implementing policies inserted in the research process. We see policies, services, and products as a result of innovation and development process for health. And most of all, it's to address societal urgent needs, to avoid doing harm in public health interventions, to improve health equity and the health situation of populations, and to strengthen health systems and health care providers. So basically, what is Evipnet, or the Evidence-Informed Policy Network? Evipnet promotes the systematic use of evidence in policy making in low and middle income countries. It promotes partnerships at country level between policymakers, researchers, and civil society to facilitate policy development and implementation through the use of the best scientific evidence available. Also, WHO promotes partnerships at a country level between policymakers, researchers, and civil society to facilitate policy development and implementation through the use of the best scientific evidence available. Evipnet is a global social network in countries in Western, Pacific Asia, Africa, Latin America, and the Eastern Mediterranean regions. Quoting Professor John Lavis, who is Evipnet's Global Steering Committee co-chair, Evipnet promotes a decision-making system in which the dynamic elaboration of research agendas, the formulation of policy, policy implementation, and feedback through operational or implementational research are closely related. A systematic review on health policymakers' perceptions on of their use of evidence, of research evidence, and I'm sure your own personal experience also would agree. The systematic review shows that interactions between researchers and policymakers are not an easy task. But there are some facilitating factors, such as an early interaction in the process, not a post-facto interaction, but before the research is conducted frequently. A matter of trust, or the perception that research must be timely, relevant, and of sound quality, and also the user-friendly formats, or the elaboration of summaries with policy recommendations that can help the work of the policymakers. So I'd like to discuss with you some of the Evipnet building blocks. What is necessary to really do a very high standard, very high quality translation of research evidence to policy. First, the basis of Evipnet are the country teams, and also some regional and global support structures, such as a steering committee, a global steering committee, regional steering committees, and a global resource group of brilliant minds that have helped us to develop and improve the methodologies we have been using. But the core of Evipnet are the country teams that are always formed by at least one or two researchers and two policymakers. and expands according to the theme that is being addressed. Another important building block for Evipnet are the research synthesis and policy briefs that are produced by the country teams. Also, there is a very important component of capacity development and empowerment, not only of researchers, but of researchers working together with policymakers to better learn and produce the necessary policies. And also another important building block is the country policy dialogues that we call the safe harbor dialogues, in which participants of civil society get together with policymakers and researchers to discuss the policy options contained in the policy brief. Also, I would like to show an example of how we work. For instance, the first Evipnet policy brief that took place in Addis Ababa in 2008, in which 8 policymakers and 7 researchers got together to learn together by doing knowledge translation, and hopefully to better work together in a sustainable way afterwards. In the Evipnet policy brief workshops, we have promoted several of them in Africa, Latin America, in the Caribbean, and Western Pacific Asia, to develop evidence-based policy briefs on any priority topic. Some examples of those topics are how to scale up the use of ACT to treat malaria, effective financing of primary health care, gender women health and primary health care, and several other themes. The Evipnet policy brief workshops, before the workshop, we identify relevant systematic reviews that work as our gold standard, and it's what most of you are engaged in producing. We use national research. The country teams locate relevant studies specific to a country or sub-region, and also we use the burden of disease data available in the country. During the workshop, we identify at least 3 policy options, work plan, and produce a work plan for a deliberative country dialogue. And after we finalize the draft of the policy brief, we present it to the Minister of Health within the context of a deliberative country dialogue, in which other sectors can participate and give also their input in how those policies should be implemented. Well, the main products of those workshops are the policy briefs with policy options in user-friendly formats that have a 1 executive summary, a 3 a bit more elaborated summary, and a more technical, solid 25 pages document. The policy briefs include supportive governance, financial, human resources, and delivery arrangements within health systems. They also address cross-cutting equity issues and enter into implementation strategies that include the costing of each one of the policy options. So the question we would like to leave with the audience is, how can Evipnet methodologies, mechanisms, and experiences help South Asia? We will have an additional opportunity to discuss this in further detail at the Southeast Asia Regional Conference on Epidemiology that will take place in 8 to 10 of March of this year in New Delhi, and the theme is Evidence to Policy and Action Through Partnerships. And there will be one specific session on establishing the evidence-informed policy network in the region. So I would like to ask you to contact us and to help us to develop what would be the best path and how can WHO really assist the region through our Southeast Asia regional office to really be able to assist both researchers and policymakers in getting together, in building partnerships to really address urging health issues that hopefully can strengthen health systems and improve the health situation of our populations. So once again, thank you very much for your for the opportunity of being here and for the contributions that you may want to make for the improvement of our global network for evidence-informed policy. Thank you very much.